Welcome to the Purposeful Lab, a Franciscan University show. And it's a show where we examine a variety of different topics that are related to purpose and ultimate meaning. And we do this using the wisdom of the church and the best of all the various academic disciplines. And so this season, what we've been looking at is the topic of the nature of men and women. And my guest today is Dr. Rashad Rehman, a philosophy professor here at Franciscan University. Rashad, welcome.
Thanks, Dan. Appreciate it. Glad to be here.
Well, it's great to have you to talk about this topic, and we're having psychologists on the show, medical doctors, and of course a philosopher on the show to talk about the nature of men and women. Let's just, before we jump into that, let's give our listeners just a little bit of background about your academic and personal background, so they sort of get to know who you are. And so you've been here at Franciscan now for a little over a year. You're in your second year here at Franciscan. You had a PhD from the University of Toronto in 2023 in philosophy. What was the dissertation entitled?
It was entitled The Ethics of Intersex Pediatric Surgery.
Okay, so intersex pediatric surgery. And so you can see that that's an issue that is going to bring up the nature of men and women and what is, sort of the proper way to live out someone's sexuality and so forth. So that's one of the reasons that we wanted to have you on and so to give some clarity on this topic, a topic where there's a great need for that in our culture. So just, you have an interesting story. You not only recently came to Franciscan, but you're also a convert to the Catholic faith. But maybe you could just tell us a little bit first about what got you interested in philosophy. Have you always been a philosopher as a little kid? Did you walk around thinking, I'm going to be the next Aristotle here?
That's a funny way of putting it. So I didn't know that philosophy was I was going to say a venerable discipline, but even an academic discipline until I was, I think, maybe 16 years old.
Okay.
So I thought...
You got me by a few years, though.
That's fair. So, I thought that when I asked a really hard intellectual question at the ripe age of 16, I said, how is it possible that there's a good God and that evil exists? I thought I was the first person to ever have actually asked that question. Like, I thought that it was original to me, and it was actually, it was a startling surprise to find out that actually people have cared about this forever. But yeah, so what got me into philosophy was, so I guess I was naturally always inclined towards intellectual questions. I always found that existence was a kind of strange thing. So I was raised somewhat kind of borderline agnostic and Muslims kind of simultaneously. Okay. So in my upbringing, I was kind of told two separate things. So one was that God was this kind of generic, ultimate creator of the world, but only had like a kind of distant interest in human beings. And then on the other hand, that Islam was true and no questions were to be asked about that. Yeah. By the time I hit about 16, I was at a standstill of sorts until I met an extremely, well-versed philosopher and theologian by the name of Patrick Sullivan. I remember just meeting this man and thinking, okay, he's on to something. Every time I ask a hard intellectual question, he brings real intellectual power, but also religion into it. Okay.
Is this someone that you met in graduate school or as an undergraduate?
So this was at 16, so I was in high school. Yeah, okay. So I was a teenager, and it rocked my world to see how it was possible to have intellectually satisfying answers to hard intellectual questions that were religious in nature. I thought that those two things didn't go together, religion and intellectual inquiry. Right. But he sort of opened up my world and showed me that that you could in fact be religious and have intellectually satisfying answers. And then that led me on a sort of trajectory of thinking about Christianity more specifically and thinking about not just the claims of generic theism about belief in God, but also the truth claims of Christianity. And by the time I was 17 and 18 in grade 11 and grade 12, taking philosophy courses, I was convinced that Christianity had the best answers to my hardest questions. And then, thanks be to God, my first year of university, I went in RCIA, and the rest is history.
So philosophy kind of brought you into the faith, like thinking these intellectual questions.
Oh, absolutely. Yeah.
It's funny because I think at Franciscan, there's a high percentage of our philosophy faculty that are are converts. Do you think there's something to that? It's just sort of just a random chance that that's the way it worked out here at
Yeah, that's a good question. So the one thing I sometimes have these discussions with converts and then also with cradle Catholics. What are the pros and cons? I mean, so let me just clarify. So like, baptize your kids. It's all pros there. But there's certain things that I think you gain and lose kind of depending whether or not you're a convert. But the one big thing for a convert is that we, I guess, by and large, we remember what it was like not to have Christ and Christianity in our lives. And so there's a kind of level of like, I have to take this seriously. I know what the stakes are at a very deep level. Whereas I think if you're a cradle Catholic, I mean, you certainly can have that, especially with the right kind of catechesis and upbringing. But I think as a convert, you're very much compelled and very forced.
Yeah, you're much less likely to take it for granted in the sense that you see in cradle Catholics.
That's one explanation, but
not sure. Okay, well, that's interesting. So, in your academic journey in philosophy, particularly in grad school, your thesis has to do with intersex conditions. How did you end up there? Because it's obviously a very controversial topic. I can imagine in a lot of philosophy departments, people wouldn't touch that topic as a graduate student with the 10-foot pole. Stay away from that. I'll find something a little less controversial. Keep my head down and get through. So what brought you to that topic?
Yeah, that's such a good way of asking it. So when I was in my senior year of university, I was applying to grad school, and my main interest was in kind of ethics, considered as the philosophical study of the good life, but also bioethics, which is the study of ethical questions pertaining to human life and death. I was always interested in those. I did pro-life street activism in my junior and senior year, and I had pretty much abandoned it for the reasons you just said. It just seems like career suicide. It just seems like a very bad idea to just say, hey, there's two genders. Who in the world wants to, supervise my doctoral dissertation or something? So I dropped it, and then I ended up getting into a pretty prestigious tri-departmental program at the University of Toronto called, at the time, the Collaborative Specialization in Ancient and Medieval Philosophy. And I had a graduate writing sample on St. Augustine's Confessions. I was on 6-8-13, this great story of Alypius at the gladiatorial show. And I was going to work in a really niche field called the ethics of epistemology, and I was headed towards a career in medieval philosophy. I became uninterested in pursuing medieval philosophy as a career, and so I took a sort of gap year during my second year of the doctoral program. And then in my third year, I took a course called Topics in Bioethics. And it was run by two clinical ethicists, Dr. James Anderson and Dr. Jennifer Bell. And they ran this course, and we read one of the most fascinating articles I'd ever seen. And it was by this intersex person, Morgan Holmes. And it was on intersex conditions, disability rights, surgery on infants with intersex conditions. And it was the first time that I had ever really looked at an ethical question and thought, I have no moral intuitions here. I don't know what an intersex condition is. I don't know what this surgery is. And so it just led me to think about those issues, to see if there were any, resources in our Catholic intellectual tradition, and it turns out that it was one of those areas that's very much nascent. It's in its infancy, and so I thought this is a kind of ripe area of intellectual inquiry, as long as someone will supervise it. And thanks be to God, I found a great supervisor.
Well, great. That's an interesting story about how you got into that. So, looking at the sort of your CV and things that you've done, I noticed that one of the sort of philosophers seems to have influenced you, or you've done work on, is Joseph Pieper. And so how is that related to your intellectual journey, and how does it help frame sort of what you do and so forth?
Yeah. Well, the best part about Pieper is that in 1991, he had an interview with Thomas D. D'Andrea at the University of Notre Dame, and he says this really dismissive comment about ethics and metaphysics and epistemology, and says, I have no interest in those. Like, they're always going to be around. Those problems are always going to be there. He said, what I'm interested in are the timeless truths of existence and human nature. So Pieper did not help me in ethics, did not propel the study of ethics, in fact, discouraged it. But what I found in Pieper, and one of the reasons why I care about him so much, is that I think that he has an incredible reading of the Catholic medieval philosopher St. Thomas Aquinas. He reads him as a philosopher interested immensely in the truth of things, with an aim to a deep, objective understanding of reality that places the intellect in the right kind of relationship to reality. And so what I found in him was something like a philosophical methodology through which I could actually ask interesting questions and hard questions, but also a kind of mentor and model for what I think good philosophy looks like. Small books, simple language, bringing clarity to issues and not being content with obscurity, looking out for sophistry, and just having the true spirit of a philosopher. That's what I found in him. And so he's sort of been a sort of guiding mentor, as I think, through philosophical questions and even bioethical ones.
That's great. Yeah, I think that's true of academia in general. the burying yourself in terms people don't understand and sophistry, but just getting at the truth of things without some agenda behind it. It seems like what philosophy should be, right? And what all academic inquiry should be. Unfortunately, we know it's not always that way. So.
Well, G.K. Chesterton has this nice line. He says that it's not the big words that are hard, it's the small words. And I have always found that to be right. I mean, you go to university thinking you're going to get, by the time you leave, your sort of vocabulary is just going to be so much more rich and expansive. But the truth is, you're like, actually, man, all these really simple words like to be, to exist. You start with the big ones, and it's tough.
You can't even get past those. Well, it's great. So why don't we get into the topic that we've been dealing with this season, which is sort of the nature of men and women, and one of the sort of fundamental questions that I've been talking to guests about is this distinction between biological sex and gender, right? And what is gender? Is that even a useful construct in the work you do? Or do you think it's something that sort of hinders us at getting at the truth, sort of gets in the way of the underlying reality? So maybe you could just talk a little bit about the term gender, where it comes from, why it's such a mushy term nowadays.
Sure, yeah. I like that term, mushy, amorphous, something like that. Yeah, so one of the most interesting facts about the term gender is that it actually was initially used as a synonym for biological sex. So you have this term, and one of the indications of that is that the term gender has as a prefix, or the prefix from which the term comes, is actually gene, or to beget. And so you already have the indication that gender is something intimately connected to something like biological sex. And then the question is, well, how do we get a concept of gender that's entirely divorced or separated from biological sex? And the answer there is that it's a post-1953 feminist invention or use of the term gender that thinks of gender in terms of malleable social roles rather than having anything to do immensely with biological sex. And so the historic idea was pretty straightforward. If there were two biological sexes, and this seems to be kind of evidenced in the reproductive capacities of human beings, you have one set of human beings who produce large gametes, and you have one set of human beings who produce smaller gametes, and this is the sort of reproductive structure of human beings. Then you have biological males and females, and if gender is something connected to sex, or if gender is something close to what sex is, then it seems like you just have a straightforward case for not only the sex binary, but also the gender binary.
Yeah, and so it seems that the gender term has become sort of, like you said, a social construct that becomes unmoored from biological sex. So the gender roles are something that have nothing to do with sex, it's just sort of inputted by society, or they're what I want, to the way I'm going to live out my sexuality. And so, do you think at this stage it's a useful term, or is there a way to to use that in a fruitful way to get at the reality of what we are as men and women, or the reality of the purpose of biological sex?
Yeah. So I think there's a couple things. So maybe there's something like two questions then. So on the one hand, what is gender from a Catholic perspective? What are the options on the table in thinking about what gender is? And then on the other hand, what do we say in response to modern conceptions of gender that are completely unmoored, to use your term, from sex? So we'll start with that first one. So I think that gender could mean one of two things from a Catholic perspective. So on the one hand, I think it refers to something like a synonym for masculinity and femininity. So when we talk about what gender is, and we talk about the sort of social dimension of what it means to have a biological sex, the term that we use to pick that out is to act in, male typical ways or female typical ways. And this is just to talk about masculinity and femininity. And so I think there's nothing in that sense to worry about. The other option is to say something like that the term gender is no longer something like a useful term insofar as we should just, recognize that the term gender carries all sorts of connotations of, the sort of malleability of human nature, the malleability of one's biological sex. And so maybe it's not the most useful term. We should just talk about biological sex where we do at least have some clarity, although intersex conditions is the great counterexample, or the great attempted counterexample. But that's at least one option. And so I think that, and maybe there's even a third option, and that's just to say that it's just a synonym for biological sex.
Yeah.
And then kind of recognize that historical distinction that was made between something like biological sex and then gender understood as something totally different,
right,
that's contrived. I mean, the sort of metaphysics to actually back that kind of bifurcation, to say that, we're totally one thing in one sphere and we're totally one thing in the other. It sounds like Cartesian dualism, right? Where what I am up here is just different than all the stuff that I am here.
Right.
So that's the first question. And then in response to the second question, so how do we think about modern conceptions of gender and where they come from? There's a few options on the table. There's a few things to think about. So one view is just something like straightforward self-identificationism. So this is where if I say that I am a man or I say that I'm a woman and mean it sincerely and it's authentic, then I just am. And I think the response there is maybe a little bit flippant, but I think it's important, and it's just saying so doesn't make it so.
Right, yeah.
That certainly is one thing, especially on analysis. If you think, and this is a great point by Abigail Favale, she says, well, what does it mean to feel like a woman? What does it mean to feel like a man? Under analysis, it just seems to be something like feeling like a woman or feeling like a man. But that's not incredibly helpful. Especially in a way that avoids gender stereotyping, right? So to feel like a woman is to feel like, maybe I'll use the male example, to the man example. But to feel like a man is to feel like, I don't know, I have like testosterone coursing through my veins and I want to listen to rock music. I don't know. I don't know what it means to feel like a man. I know I'm a man, but and so, barring that, self-identificationism just seems like a view that either is simply not backed in reality, in the sense that it doesn't pick anything out ultimately, though saying something doesn't make something so, or it ends up in some of these stereotypes.
Yeah.
That's one view. Another view is called social constructionism, and that's the view that you illustrated. And that's just that gender is a complete social construction. There's just these categories in reality by which we individuate persons socially, and you might have a view about kind of how this works, philosophically at least. But one of the big problems there is that, here's a couple, right? Here's some for our viewers to think about. One, who's doing the social constructing?
Right, yeah. Who's deciding on what the male role, masculinity is and what femininity is? Right?
That's right. And there's this Catholic priest father, Harry Gensler, who passed away recently, but wrote a great book called Ethics: A Contemporary Introduction. And he has this point about some moral theories, and he says that there's like a subgroup problem that can arise. So so I'll apply it here. So who's doing the social constructing? Is it your family? Is it your, is it your religious identification? Is it society at large? Is it waves of cultural trends? Who's doing the social constructing? And so that level of vagueness is a real problem for the social constructionist account. Another is that your gender can become involuntary, which is not good. Yeah. So think, for example, about suppose that gender is a social construct. So the social meaning attached to sexuality is something that's totally in control of society. So society says that if you play with Barbies and you wear pink, then you're a girl. Yeah. It's like, well, if you have a boy doing that, then they become a girl. And it's like, well, that's not good. Suppose that this boy says, well, no, in fact, I really am a boy. And there's all sorts of reasons why. And it's like, well, that's fine. But maybe you have a sort of female or a woman gender. Again, that just seems like gender seems to be the kind of thing that shouldn't be involuntary. Yeah. It shouldn't just be society does the dictation. And then even if you say, no, look, I'm a man, and it's very obvious that I'm a man, it shouldn't be that because of certain kinds of behaviors that you're then indicated a woman or something like that.
Yeah, it does seem like, at least in the church, we would say, every man has to live out his vocation in a different way. Every woman is going to live out her vocation. So the way that I live out my masculinity is going to be unique, right?
Right.
And so, but it falls under some sort of general patterns, and the most general one is sort of my biological reproductive capacities, right? Which is different than the way a woman lives out her sexuality with her female reproductive capacities. But there's almost an infinite way to live those out, right? And I think if you detach that from the grounded in biological reality, it seems like then gender is whatever you want it to be, right?
Yeah.
Right? Because it is, it is a diverse way that you can live it out, right? You're never going to bear children. Right? I hate to break it to you, but so you can live out your masculinity.
Yeah, just to clarify, I do know this. This is not news.
But we know that's one way we're not going to live out our masculinity, right?
That's right.
So
that's right.
But it's interesting nowadays. People seem to have now are questioning that, right?
That's right.
The idea. So not only is gender maybe just whatever I want it to be, but now biological. The term sex is now no longer grounded in any sort of biological reality, right? That dualism you're talking about, right?
Yeah.
Where I do have, biologically, I have the characteristics of a male, but no, my sex is female, or it's assigned,
That's
to me as what do you think is behind that? I mean, what gets people? I mean, I could sort of see like the gender, and you see the modern feminist movement, reacting against certain bad stereotypes, right? And you could see how that. But what is it that's driving this? See, as a biologist, this disconnect. This is one of these weirdest things to see. This disconnect between biological reality and sex.
Yeah. I think that's a really good question. I mean, I think there's a number of things that you could say. I mean, is it just something like, does technology use have something to do with the idea that we feel much more dissociated from our physical bodies? Is it secularization in which we are unintelligible in some capacity on a cosmic scale? Is it postmodernism in which like really heavy-handed truth claims are to be doubted? I mean, is it, again, is it intersectionalism in which human beings aren't to be analyzed in terms of, like heavy-handed metaphysical categories? I mean, think of, Aristotelianism and Thomism, but just in terms of like power relations with one another, and then really deep claims about human nature and existence are just meta-narratives that we need to throw out. I mean, I think it's just a really good question. I think it's a hard question. But one of the most important things to note is, regardless of how we can parse this out historically, and some people have done pretty good work on this, is that a lot of the confusion regarding gender is not simply in virtue of the fact that people learn about Cartesianism and think there's a difference, or they learn, they read like Judith Butler or something, and they're like, maybe there's a distinction. A lot of the times, questioning one's gender comes from a psychological condition known as gender dysphoria. And so I think it's important to note that like we have here two kind of separate classes, I think, of individuals. On the one hand, and this is the stuff that I am interested in, have some kind of expertise on, it's conceptually speaking, what is gender? And are there different views of it, some which actually do bear some connection to reality and some which don't, which is what we're talking about. And then on the other hand, why are individuals gender dysphoric? Why is there such a thing as gender dysphoria? Is it a type of psychic fragmentation in which one simply feels a kind of dissociation from one's body? Is it in virtue of things like adolescent trauma? I mean, again, that's very much the psychological dimension. I'm glad you have psychologists on the show because I won't touch that. I think that's a great question. I think it's important. But at least conceptually speaking, how we get here, I think, as I illustrated before, there's certainly lots of possible reasons. And Dr. Matthew Bruninger has a nice line on this too, right? Especially when asked, by you actually on a former episode, how do we get here in terms of like the sort of, where we are psychologically and this sort of sense of meaninglessness, even culturally and socially? How do we like get there? And I like the way that he put it. He said it's a kind of convergence of all of these things. Right. And I feel similarly with how we got here with respect to gender.
Yeah, exactly. Yeah, Dr. Bruninger was on previous episode when we were running this through the Maja Center, and he was an excellent guest. So why don't you do a lot of writing on sort of intersex conditions, right? And so this is always an argument that people will make. So look, there's not two sexes, there's male and the female, and then there's these other intersex conditions, right? So maybe if you just start like what is, because people define, getting terms defined properly, because a lot of times intersex conditions, people think someone with gender dysphoria who just think, hey, I'm a male body, I think I'm a woman, so I'm an intersex. That's not what we're talking about here. So maybe you could explain what an intersex condition really is.
Yeah, it's a good question. So, let's start this way. So Aristotle in the Nicomachean Ethics, at 1197, he says that we should begin with the well-known. And so again, if we think about what the terms male and female are, in the context of human beings, of course, and so here we're thinking of males and females as defined by the reproductive capacities in the production of, or in the developmental pathways towards the production of large or small gametes. it's really then the framework in which we can ask what an intersex condition is. Because if you look back from reality altogether and you just see human beings being male and human beings being female, and then you've got some gray area, right? You might just think like, oh, well, then that just shows that there's lots of sexual diversity. Maybe there's not such a thing as male and female. But I think that the bedrock on which we even ask that question has to be in light of what's meant by male and female. I mean, think about it, intersex, or between sexes. Now the question is, are you between in the sense that there's a third sex, or sexes are socially constructed? Or is there something like, and this is the view that I take, that intersex conditions are a disorder and difference of sexual development that results in a lack of clarity with respect to one's biological sex? So that's the definition of an intersex condition that I would give. And I can break that down a little bit. So if you think about the difference component, I mean, I think that this is especially people who want to use intersex conditions as a counterexample to the sex binary, we'll say. Yes, they have different sexual anatomy, like of course, right? So individuals, for example, with congenital adrenal hyperplasia, which constitutes something like 80% of cases, this is a condition in which you have the overproduction of sex hormones and the underproduction of corticosteroids. Yes, they look sexually different, that's true, but the question is, are they male or female? Can we answer that question, or do they just merely have a different sexual anatomy? Well, the answer is both. So in some cases, they can be biologically male if they have small gametes, and if they have large gametes, then they're biologically female. And then what happens in an intersex condition, particularly in CAH, is that you have a disorder of some kind that drives the over or underproduction of one's sexuality. And so in the case of CAH, as I said, you have the overproduction of sex hormones and the underproduction of corticosteroids. And the driving force behind this is actually a genetic disorder called 21-hydroxylase deficiency. And our viewers, of course, can look this up, look into this for the genetics of this. So what we're not talking about is simply just bodies that look different, and then Catholics look at intersex conditions and we think like, well, you just don't fit in our categories. It's not like that at all. It's that what we're talking about is a medical condition that obscures one's biological sex as male or female. And of course, this can be distressing. I mean, not knowing what your biological sex is, and it can become hard asking vocational questions. I mean, can I become a priest? If I don't know my biological sex? I mean, so again, right, like some of these questions are really important. But the whole point here is just to say that intersex conditions themselves, which are, again, just to clarify, they're not as common as being redheaded as sometimes is thought. On the most reliable statistic, it's about 0.018% of the human population. This comes from a researcher, Leonard Sachs. We're talking about medical conditions that obscure biological sex, but have nothing to do with whether or not one is in fact male or female. Now we can admit, of course, you know, in some cases it's just really hard to tell. Maybe there's a lack of ethical ways of even finding that out, and that's, you know, again, that's fine, and that's a cross to bear for some of these folk. But that doesn't have any bearing on whether or not human beings are male or female. It's referring to something else.
Yeah, and it seems like conditions like CAH, where the people are like a biological one in terms of is overproducing, say, testosterone, right? Most of those cases, those people, they're not confused. They think they would anyway. I'm a woman, right? And my sexual anatomy is not developed properly because of the excess of testosterone. So even in like a condition like CAH, which is, you know, one of the more common, as you point out, most of those people wouldn't say they're intersex, because intersex, you're saying, is a condition where it's ambiguous. We don't know, right? So that you know, the person has a difficult time determining whether they're male or female based on sort of their reproductive anatomy and so forth, right? So
that's right.
So in terms of like the treatment for these, I mean, I think you did your thesis on, like, particularly children, right, that present like this. What is, you know, what case did you make there?
Yeah, that's a good question. So the case that I made there was something like, in most cases, it seems absolutely prudent not to perform what I call intersex pediatric surgery or sex clarification surgery. So this is importantly distinct, maybe I should just note this, this is importantly distinct from a couple of surgeries. So one, this is not gender reassignment surgery, where someone says, I am a biological male, but I really feel strongly that I'm a woman, and so I perform surgery to become something I'm not. That's very much not what we're talking about. Neither are we talking about cases in which, so for example, sometimes intersex pediatric surgery is coupled together with female genital mutilation or other mutilating surgeries. And the idea is that, and again, so you have to buy the social constructionist narrative to get this, but you could say, well, sex is only something that's assigned at birth. It has nothing to do with your biology. It's just how we categorize people.
Right.
And so performing surgery on these children is just society's norms imposing on some of these children. And look, I mean, when that happens, there's something deeply terrible about that. We agree. When we're talking about intersex pediatric surgery specifically, we're talking about surgery that's designed to simply clarify the sex of the child. And the case that I make there is that it can be morally permissible in pretty select cases, but the biological sex has to be known. The risk for physiological harm has to be really low. And then, of course, in ideal circumstances, of course, optimal psychological care is available for that child as well. And then I think that when those conditions are met, then you have a pretty good case for surgery being morally permissible during infancy. And the reason why it's controversial, so I mean, in our kind of culture, no one's saying, later in life, if you consent to it or if you autonomously choose it, no one has an issue with having surgery later. That's a whole different thing. But in terms of the reason why it's so contested is that these are parents or substitute decision makers and healthcare teams making these decisions for the welfare of the child. And so if your view is that, look, if we can know biological sex, it's a good thing to grow up with one's anatomy reflecting their real biological sex, then surgery seems okay, again, barring those conditions, barring those ethical conditions. Right. And then in some other cases, waiting is another absolutely appropriate thing to do. And so there's a nice distinction that Dr. Aaron Kheriaty made. He made a really good point in this regard. He said there's a difference between, well, I'm extrapolating a little bit, but there's a difference between waiting until the child is older for the purpose of getting their informed consent to perform surgery. That's one thing. Yeah. It's another to say, look, if we don't know the biological sex, maybe we should wait until we do, and then again, make a decision for that child or have that child be part of the decision making. But again, one is for purely autonomy based reasons, right? I mean, just as a child can choose their gender, so too they can choose what surgery they want. That's not what we're talking about, but it might be appropriate sometimes to delay surgery so that you can actually see and ethically know whether or not the child is male or female. Right. Yeah. And then the question of surgery as a treatment recommendation is then on the table. Yeah. So it can be prudent. It can be prudent either way. But one of the big contributions that I wanted to make, and maybe I'll sum up with this. One of the big contributions that I think needed to be made, especially in the literature, is appreciating how complex the decision-making actually is. Oh, okay. So when you hear, for example, the testimony of intersex folk who have had surgery and really negative experiences, you can get the impression that, well, why don't we just get rid of this surgery altogether? There's something kind of terrible about it. And there's certainly some real truth to that historically, when the surgery was extremely experimental, when sex was unknown and you just flipped a coin and hoped for the best. I mean, you have some of these really terrible cases, or parents who were in so much distress not knowing the sex that they just said, just pick one. Mm-hmm. I mean, you have terrible cases like this, but when we're talking about ethical cases of this, we still have to appreciate, like all medical decision making, there's lots of goods on the table, there's lots of variables on the table, and decision making has to be prudential, it has to be informed to the greatest capacity, but that again, it's an imprecise science in some capacity.
So you've pointed out, these intersex conditions are sort of a disorder of development. The goal is for the reproductive system in utero to, as you're growing, to develop into the male reproductive system or the female reproductive system, right? And so these intersex conditions, it's not getting to one of those ends, and it's getting to something that's not clear where it's getting, right? Mm-hmm. Is there a danger in saying, okay, well, people say, hey, if we just say they're a third sex, then they feel like, oh, I am something, rather than say, no, you have a developmental defect, right? And people make that argument. What would your response to that? To say, no, we don't want to create a third sex. In that, for pastoral reasons, right? But to say, no, there's still just male and female, and there's intersex where we're not sure, or there's been a disorder of development. And it's interesting because they kind of, in psychological manuals, try to get rid of that. Gender identity disorder is now gender dysphoria, right? So there is some movement to get rid of things that are disorders. I mean, what would be? How would you respond?
No, that's such a good question. No, you're bringing up really, really excellent questions. There's a couple things to say here. So one would be There is one legitimate concern about pathologization.
Right.
And I think that's maybe part of the reason why some want to classify intersex as a third sex, or maybe they want to say, that, and this is the more common view, that intersex isn't a third sex, but it's something like an indication that sex just sits on a great spectrum.
Yeah. Okay.
And so there's a couple of things to say there. So the first is that, so when it comes to pathologization, we need to appreciate that when we're talking about an intersex condition, we can absolutely pathologize them. So for example, suppose you've got an intersex person who has, for example, a larger than average clitoris. That's not a disorder in any relevant sense. I mean, you might say it's socially disordered or something like that, but that would just be wrong. That would be categorically mistaken in some capacity. I mean, it's outside the norm, but it's how do you get from there to all the way to like it's a pathology of some kind? But remember, when we're talking about intersex conditions, they are not mere differences, but they're differences, but also disorders in the medical sense. So if you mean that an intersex person is disordered, then what you're doing is saying something mistaken. They're not a disordered person.
Yeah, right.
In the same way that someone with autism or anxiety or anything like that, they're not disordered. They have a disorder. And so it's true. Nouns can become substantives, and so we always have to dissociate them. That's why person-first language is such an important thing. But the second thing to note is that why isn't intersex just a third sex then? Okay, so let's say that we've addressed, so we're not pathologizing, we're not just arbitrarily applying the concept of disease, but it's only in terms of a medical disorder and distinctively functional terms, or we're talking about a kind of dysfunction, say at the genetic level or something like that. So why is it not a third sex? The reason why it's not a third sex is that sex is defined, again, going to what's well known, by gamete production. And because there's no third gamete size, they can't be a third sex. Now, I mean, imagine someone said, well, why can't we just consider them third sex or something like that? But again, pragmatic questions like that, what's useful and not, I mean, that's a different kind of question. But if we're really wondering and inquiring as serious pursuers of the truth, is there, in fact, a third biological sex? The answer is no.
Right.
Is sex, does it sit on a spectrum and then maybe intersex just kind of fits somewhere along that line? Well, that would be true if you thought that biological sex referred to, as Anne Fausto Sterling puts it, this medical historian who wrote a very famous book called The Five Sexes, if you could distinguish between like genetic sex, phenotypic sex, anatomical sex, and so forth, then you could have all of these overlaps in the usages of those words, and then you could get a whole variety of sexes. But again, what Fausto Sterling failed to recognize was that when we say genetic sex, phenotypic sex, and so forth, well, what's the meaning of sex operative there, right? There has to be something that gives intelligibility to genetic sex. And so the question is, what is sex? Not just what is genetic sex, but what is sex? And that's defined by gamete production.
The function of it. Yeah, so you're saying there's something that's XY, but has a female gametes. It's like that distinction. She's saying, oh, well, maybe that's a male genetically female gamete, so we're going to call that a different sex, right? But you're saying, no, we're going to use the end of sex is the production of gametes. The chromosomes are there to get to that goal.
Yeah,
and actually, that's where we should order our.
Oh, that's great. Yeah, and there's the philosopher at MIT, Alex Byrne, who puts it really nicely. He says the person who thinks that chromosomes are essentially what defines sex. When someone thinks that that sex is defined by. Let me re-say the whole thing. Alex Byrne has this really nice line in a short article of his. He says that if you see in a discussion that sex is defined by chromosomes, then the discussion has gone off the rails. And the reason why is that, again, chromosomes are the mechanism by which placental mammals like ourselves become male and female, but aren't identical to sex itself. And so by using the chromosomal model, you actually just fail to understand what, in fact, biological sex is.
Yeah, that's great. No, that's a good point. We're getting here to the end of our time, and I've been asking, this season, all of our guests just a question about, what the church has to offer on this subject. So, what is it that, that a proper understanding of sex and gender that the church offers that can lead to human flourishing? Because often the stereotype is the church's view on sex, it's restrictive, only two biological sexes, you have males and females, you have masculinity and femininity, and it's preventing people from expressing who they really are, right? And so how is it that you would say that the church's view on that it actually leads to human flourishing?
Yeah. I think that's a great question. And I think actually, one really great place to start would be what's called Eden Invitation. And Eden Invitation is a Catholic organization that tries to address 2S LGBTQIA plus experiences and gives them they give them support and community and a real place to just recognize that the love of God extends even to them. And I think that would be a great place to start.
Yeah, so one of the things I think that the Catholic Church provides, there's this sort of this integrated version of the human person as opposed to this fragmented, well, here's my body and I've got to overcome that, it's an evil thing, or it's hindering my flourishing. But no, that body is what God gave you to flourish, right? And there's something to that about the biological male and female, and that's the way God made you in a sense. Or even if you're intersex, that's the way God made you, and that's the body that God gave you to flourish in, right? Is something that do you see that as a way in which the church sort of tries to get at this?
Yeah, no, absolutely, and I think that's extremely well put. That's better than how I would put it. I think that's just right. I think what you get in Catholicism that you don't get in something like gender theory is comfortability in your own skin, even regardless of some of these experiences. So for example, for a person who has gender dysphoria and is struggling with it and is even receiving like mental health support for it, but still finds these deep, persistent feelings of just like, I just am somehow not the same thing as my body.
Right.
I mean, like the love of God extends even to that person in their suffering. And so I think in some cases when it's a matter of, voluntarily accepting a view of sex and gender that don't match reality, and then it's a question of like conceptually parsing that out to recognize like, oh, okay, maybe I am really a unified organism. Maybe that's just true. Yeah. I mean, I think that's one thing, and especially with the sort of philosophical analysis that I gave earlier of what gender and sex are. I think that specifically applies to that. But when it comes to, even individuals who, again, like not just have gender dysphoric experiences, but are struggling with gender dysphoria, the church really is a home for the sick. And I think it's a home to really heal. And that applies just as much to folk with gender dysphoria, intersex conditions, as it does with anyone else.
Anybody else, yeah. It's a place to heal. Everybody needs that healing in some way, shape, or form. Yeah. So that's great. Well, thanks for being on the show with us. We really appreciate it, and we'll have to have you back on at some other time. Thanks for viewing. And if you're interested in this topic, the nature of man and woman, we have this whole season we've been addressing this. So please look at other episodes of Purposeful Lab, and we'll see you then next time on Purposeful Lab.